Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. A study by the World Health Organization has proven that long working hours have killed hundreds of thousands of people in a year. The study, which is first of its kind globally, showed that at least 745,000 people died in 2016 from stroke and heart disease due to long hours of work. The research found that people living in Southeast Asia and the Western Pacific region were the most affected. The WHO also said the trend may worsen due to the coronavirus pandemic, which has eaten deep into the economy of most countries. As Nigeria joins the rest of the world to commemorate the 2021 International Day of Hypertension, experts in the medical line have advised all to ensure routine medical checkup is observed, as many believe that hypertension is often asymptomatic and can appear as a life-threatening ailment and can bring the strongest human down with stroke or acute heart failure. According to these experts, hypertension cannot be taken for granted. The theme for the 2021 World Hypertension Day is measure your blood pressure, control it, live longer. World Hypertension Day is observed every year to raise awareness about the silent killer. The International Day of Hypertension is celebrated on May 17 every year. And more than 2,500 women who were victims of the PIP breast implant scandal should receive compensation, a French appeal court decided. The women involved, including 540 Britons, say they are elated and exhausted after 10 years of fighting for justice. The court also upheld an earlier judgment which found German company TÜV Rheinland negligent. It awarded safety certificate for the 40 implants. The court decision could have far-reaching implications for thousands of other victims. And Kenya's Ministry of Health said Thursday it will vaccinate 3.4 million children below 5 years in 13 countries against polio in May and June. The first phase of the vaccination will start from May 22nd to 26, while the second phase will be conducted on June 19 to 23. Mutahi Kogwai, Cabinet Secretary in the Ministry of Health, said that the vaccination comes after surveillance teams confirmed 6 cases of poliovirus in February from sewerage materials in Garissa, northeastern Kenya, and Mombasa in coastal Kenya, respectively. Surveillance personnel undertook a risk assessment and identified 13 counties as being at the highest risk and opted for emergency polio vaccination in targeted regions. An antifungal drug used in the treatment of a rare infection called mucormycosis or black fungus in short of supply across states in India. Amphotericin B, which is manufactured by many Indian firms, is also on sale on the black market. There are many emergency appeals on social media for the drug as mucormycosis cases rise. Doctors say the infection could be triggered by the use of steroids in severely ill COVID patients. Mucormycosis is caused by exposure to mucor mold, which is commonly found in soil, plants, manure, and decaying fruits and vegetables. It affects the sinuses, the brain, and the lungs, and can be dangerous in diabetic or severely immune-compromised people, such as cancer patients or people with HIV and AIDS. Many patients arrive for treatment late when they are already losing vision, and doctors have to surgically remove the eye to stop the infection from reaching the brain. This is TOS Television Network, and you're watching Health 54. Do stay tuned. Welcome back. A study has shown that Immunity Bio's HAD5 T cell is a possible COVID-19 vaccine is being considered as the prospective booster shot for the almost 500,000 South African health workers who have received Johnson & Johnson's inoculation. The health workers, the first people outside of much smaller studies to be vaccinated in South Africa, will need a booster, said Dr. Glenda Gray. The co-lead of the South African studies is in an interview on Wednesday, May 19, said the HAD5 T-cell kills infected cells and in addition to the spike proteins found on the coronavirus. The shot targets the nucleocapsid protein, which is as prone to mutations. The Nigeria Center for Disease Control (NCDC) has recorded 43 new cases of COVID-19, bringing the total number of infections in the country to 165,852. The NCDC stated this on its official Twitter handle on Wednesday. The agency said 36 people were reported to have recovered from COVID-19 in the past 24 hours. Resolved cases increased by 35 from one the previous day. It stated that there were no new deaths linked to the virus in the past few days. The NCDC noted that the new infections were from 6 states. 19 in Lagos, 14 in Rivers, 5 in Katsina, 5 in Jigawa, and 1 case each in Kano and Oyo. With the new update, the agency said the COVID-19 infections tally in the country reached 165,852, while the death toll from the virus stands at 2,067, and the number of recovered patients is now 156,456 in 36 states and the Federal Capital Territory, as the virus continues to spread across the world. As part of efforts towards curtailing the spread of the COVID-19 pandemic in Nigeria, the federal government on Monday launched a sensitization campaign tagged Powerful HANDS. The Director General of the Nigeria Center for Disease Control, Chikwe Ihekwezu, while speaking at the launch, said the campaign is targeted at selected states with high COVID-19 cases in the country. He listed the concerned states as Lagos, Oyo, Kano, Kaduna, Plateau, Rivers, and the Federal Capital Territory. Ihekwezu said the initiative aims at increasing the number of Nigerians who practice COVID-19 preventive measures, which includes regular hand washing. Speaking further, Ihekwezu noted that the pandemic has led to the rapid development of diagnostics, therapeutics, and vaccines, reflecting remarkable human capacity to build on years of existing research to bring about exponential scientific innovation. He, however, said the initiative as a national social and behavioral change campaign is simpler to curb the spread of the virus. And in Ghana, the Health Service on Tuesday said the country is set to issue enhanced COVID-19 vaccination cards to people who get their second shots in counterfeit cards crackdown. According to Patrick Kuma Abaugie, Director General of the Ghana Health Service, holograms would be imprinted on the vaccination cards of those who get their second shot for authentication. In some parts of the world, people show up with fraudulent vaccination cards, claiming they have been fully vaccinated against COVID-19 when they are not, said Kuma. The Director General added that once people show up at vaccination centers, their data would be put up to verify whether they had already taken the first shot. The French authority has ordered the reopening of bars and shops as the country starts lifting restrictions aimed at preventing the spread of coronavirus. According to the official directives, from Wednesday, groups of up to 6 people are allowed to eat together at outdoor restaurants and terraces. France's nationwide curfew is also being pushed back from 1900 to 2100. And that is Health 54 right here on your Digital First Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.